Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast. Joining us today is Dr. Hassan Tabandeh, a cardiologist with Virginia Hospital Center. Thanks for being with us.
It's a pleasure being here.
Well, we're going to get into some details about your career and your area of specialty as a physician in a moment, but what I'd like to do first is just to have you introduce yourself to our audience and just to tell us a bit about yourself, where you're from, your background, where you went to school, family, any personal interests, things like that you'd like to share.
Yes, I'm Hassan Tabandeh. I'm currently a cardiologist with Virginia Hospital Center Physician Group. I started my career here with Virginia Hospital Center in 2015, and currently it's more than 2 years that I'm here. My parents were originally from Iran, but I was born in the United States. My medical school was in Iran, where my parents had moved back when I was growing up. So I did my medical school there. Then I took the boards for the United States medical licensing, and then did my residency in New York City at Cabrini Medical Center, which is affiliated with Mount Sinai School of Medicine, and then did my fellowship at Westchester Medical Center, which is New York Medical College. I moved to Northern Virginia in 2003, was with a private practice until 2015 when I joined Virginia Hospital Center. I'm a cardiologist and board certified in internal medicine, cardiovascular disease, nuclear cardiology, echocardiography, and I'm a registered physician in vascular imaging.
And if you would, you mentioned that your parents are from Iran, although you were born in the United States, but you've lived both places. For people who are unfamiliar with Iran, other than what they see on the news, what should people know about that nation? I think one of the things that we all are surprised to find when we travel beyond the borders of our country is how many similarities there are between folks. What would people be interested to know about Iran that perhaps they aren't aware of?
A couple things that is interesting about it. First is that unlike the government that we mostly see on the news, the people are very interested in Western culture and especially American. So they all look very favorably to American culture and American people, again, unlike the government that has some rhetoric. And the second question that I get very often is about the climate. And people are very surprised to know that in Iran, we used to go in Tehran, in the capital that I lived, we used to go skiing every weekend because with 1 hour distance, we could go to very high mountains with wonderful powder snow, and it was a very good ski area. And when you talk about Iran, most people imagine a very dry climate that look like a desert, but yes, we do have those type of climate in some areas in Iran, the same way as in the United States that you can have Arizona and then you have Maine. So it's a very diverse climate and diverse population.
Well, skiing in the Middle East, you learn something new every day. Thanks for sharing that tidbit with us. Let's talk about your work. As you mentioned, you've been with Virginia Hospital Center since about the end of 2014 or beginning of 2015. Can you just tell us about a typical day in the life of a cardiologist and what you do on a day-to-day basis, seeing patients, performing diagnostic tests, things like that?
I'm a non-invasive cardiologist. Now, the cardiologists are subspecialized in different specialty. They're non-invasive cardiologists, they are interventional cardiologists, and they're electrophysiologists. These are the main subspecialties, but there are a couple more. And depending on the subspecialty, your day-to-day work might be a little different. As a non-invasive cardiology, my focus is mostly seeing patients and reading cardiovascular imaging, such as echocardiography, which is the ultrasound of the heart, or the stress test, the nuclear cardiology, which involves injecting nuclear isotope that is picked up by the heart, and then you image the heart to diagnose different heart disease, and rhythm abnormalities of the heart, including Holter monitors that people wear for a few days, and then you go over the rhythms to make sure they don't have any arrhythmias. So my day mostly goes, it depends what type of practice you are in. Personally, on the days that I'm in the office, I see patients every, I would say, 20 to 40 minutes, depending on new patient or follow-up. Then in between these patients, I try to read the studies that they were done, such as echocardiogram, stress tests, nuclear studies, monitors, and also then in between you have to make sure the patient calls are answered, the questions are answered. The pharmacies have questions that you have to answer in the middle of the day, which is not specific to cardiologists. It's just something that all physicians do.
And as we all know, all of the organs in our body are vital, but the heart is essential and is very vital. I wonder, Dr. Tabandeh, what prompted you to go into cardiology as a specialty and as an area of study as a younger man?
I always liked to be a doctor, and when I went to medical school and started learning about different organs, I just liked this area. And interesting enough, when I don't know exactly when, I think probably I was in the 4th or 5th year of school when my father had a heart attack. And he was relatively young, healthy, without any medical issues, who suddenly had a heart attack. And from there on, my attention was more diverted to cardiovascular disease, and it was just interesting to me.
And I know that in a recent issue of a Virginia Hospital Center newsletter, there was a focus on cardiac health and about people improving and getting better. You're featured in that newsletter talking about family history, and you just shared an anecdote about your father. I wonder if you could talk a little bit about how the role that family history plays as it relates to heart disease.
There are different types of heart disease. It's hard to put everything in the same category, but the main category that people usually refer to when they talk about heart disease is coronary artery disease. That means that when you have cholesterol plaque building up in the arteries that feed the heart muscle and cause blockage on those arteries and result in a heart attack. So most often when people refer to family history of heart disease, this is what they mean, coronary artery disease, meaning plaque buildup in the arteries. Now, there are a lot of different heart disease which are not necessarily familial, and there are some other rare ones that also could be familial. Now, in terms of coronary artery disease, family history is one of the several risk factors that could increase the risk of plaque buildup, meaning that there is no specific cause for why people start having buildup of plaque in their arteries, including the arteries in the heart. But we know that there are several risk factors that if you have these risk factors, it increases the odds of having plaque. And one of those risk factors is a family history. And family history usually applies to an immediate family member, including parents, brothers, or sisters that had heart, again, not any type of heart disease, but specifically plaque buildup in the arteries going to the heart, resulting either in a heart attack or bypass surgery or stent at age 55 or younger. But again, this is one of few known risk factors for plaque buildup, and the other ones include smoking, history of diabetes, lack of activity, being overweight, being hypertensive, have cholesterol issues.
And so those are important risk factors to be aware of. I wonder what advice you would offer to, none of us is getting any younger, but at what age should people start getting checkups to, evaluate by a medical professional to evaluate their heart health? What's the appropriate time for people to really start being more mindful of that as they age?
In terms of being mindful of it, I think this is something that should start very early in life as part of the lifestyle, because a lot of things that we can do to lower the risk of having atherosclerotic heart disease or plaque buildup in the arteries are things that depend on the lifestyle. And changing the lifestyle is much harder to do when people are in their 50s or 60s, but it's much easier to do when you're in your 20s. So in terms of lifestyle, I think it should be taught very early in life, so when people go on with their college lives or after college, they can adopt a healthy lifestyle which long run would reduce their risk of having heart problems. And that includes obviously not smoking, that includes staying active with regular exercise. That means trying to keep their weight under control, trying to eat well, watch they eat, avoid processed food, and just simple lifestyle things that it's easy to do long run, and then if you want to change it all of a sudden at age 50. So in terms of doctors, I think I'm not sure what is the official recommendation of American College of Cardiology, but it is recommended for people to see their primary care physicians routinely, and that's something that they get checked with their blood pressure, cholesterol to make sure they are okay, but they don't necessarily need to see a cardiologist if they're feeling well and they don't have any issues. So their basic health parameters, as I said, like their blood work, like their vital signs, their blood pressure, they can be monitored by their primary care physician, and at any point there are any concerns about them or there are any symptoms, usually the primary care refers to the cardiologist. So I don't think there's any specific age that people should be concerned about seeing a cardiologist.
Well, thank you for sharing that. That's really good advice. I'd like to end on a personal note. You mentioned earlier in our conversation that there is skiing in Iran and that people would be surprised to learn that perhaps. I know that skiing is one thing that you enjoy doing. I also know from your bio that you also play the piano. I wonder what kinds of music you play when you play the piano. Is it classical? Is it more modern stuff?
It's classical music. I started playing when I was about 5 years old, so by the time I was getting ready to go to medical school, I was pretty good, and my instructor was telling me that this is the time that if you want to become a professional, you got to really start working on it. And at that point, I really didn't want to play the piano as my profession, and I kept it as a hobby. I have a 2-year-old and a 5-year-old at home, both boys, and unfortunately, because of them, I haven't been able to play the piano, because as soon as I sit there are two people jumping on me and hitting the piano keys. So I'm hoping once they're a little older, then I can start playing again.
Well, as the father of a soon-to-be 5-year-old, I can certainly relate to that. We had a piano in our old house, and my boy would bang on the keys, so I can certainly relate to that. And I will say that based on the accomplished career you've carved out, field of cardiology, that music's loss was the healthcare profession's gain. So we're happy for that. And we're happy that you joined us today, Dr. Tabandeh. And we'll look forward to keeping tabs on your career.
Thank you very much. I appreciate including me in your talk, and I wish you a good day.
During this segment of the podcast, we like to share a healthcare story that we've either seen on TV or read in a newspaper or online, something that we found interesting and think that if you have a few moments to look up, it would be worth your while and something you might find interesting as well, particularly if you are interested in healthcare. So Erin is going to join us and share one such story. Erin?
Thanks, Julian. A study conducted by researchers at Virginia Commonwealth University and Lund University in Sweden shows pregnancy substantially reduces drug abuse risk. The study was recently published in the American Journal of Psychiatry. Researchers found strong causal associations between pregnancy and subsequent reductions in drug abuse among pregnant women. Dr. Kenneth S. Kendler, professor of psychiatry and human and molecular genetics in VCU's Department of Psychiatry, said in a press release the findings from the study suggest that if you motivate people enough in ways that are important to them, they will be able to substantially lower their drug abuse risk. The VCU health professor said he hopes the study results encourage psychiatrists and others to resist the temptation to assign drug abuse risk to either biological or psychological factors. To learn more about the study, search online for VCU Swedish study on pregnancy.
That's going to do it for today's episode of the Patients Come First podcast. You can find new episodes as they become available at www.vhha.com. You can also find episodes of the podcast on SoundCloud and on other popular podcast portals. We also encourage you to engage with us on social media, including Facebook and Twitter. If you'd like to send us comments, questions, or feedback for the podcast, you can do that through our Twitter account at VHHA using the hashtag PatientsComeFirst. Thanks.